you for attending this webinar on the key factors behind coronavirus outbreaks in large workplaces and how to avoid it happening to you. The session will be led by Stewart, the Somerset County Council Public Health Specialist, and supported by Sarah Dowden, the Public Protection Manager for Sedgemoor District Council. The format is a presentation followed by a question and answer session. If you think of a question during the presentation, you can post it in the box on the right-hand side of the screen. This will then be answered by the team after the presentation. I will now hand over to Stewart Brock. Thank you.
Good morning, everybody. Thank you for joining this morning. I'm going to talk you through quite quickly, set aside for about 15 minutes on a lot of the key points we've learned from outbreaks, both locally and nationally, in the last 6 months. And the first one I want to really focus on is isolation. You're all familiar with this term self-isolation now, but I'm talking about isolating in a more general sense, about minimizing interactions with other people. We're having a lot of people who are being identified as close contacts of people who have become cases. And a key message for workforces is don't be a contact. You know, most people do not want to be excluded from work for 14 days. And the best way to do that is to avoid being a contact in the first place. So key message is keeping your distance. It's really important that people understand what isolation means. So if you are a close contact, it means basically you cannot go out, you cannot leave home, you are in effect quarantined. But if the only reason you can go out is to go and have a test. And if you go and get a negative, you get a test and you get a negative test, you still have to isolate for 14 days. So you should only go and get a test if you actually develop symptoms. If they do develop symptoms, then as I say, it's immediate self-isolation, go out for a test and stay in isolation unless they get a negative result. Okay, let's move on to the next slide. So one of the really common factors we're seeing is infection happening in transport situations, and particularly car sharing. So we're really saying that car sharing should be avoided if at all possible. But I'm aware that for many businesses and many employees do car share, obviously to reduce the costs for getting to work. And so if people are going to car share, there are a number of steps you can take to minimise the risk of car sharing, both for the people in that individual car, but also again to the business in terms of business continuity. So if you are having people car sharing, it's really good to make sure it's always the same people sharing the same car. Effectively, you have a bubble of those people, so that if somebody in that bubble gets COVID, then the only people who potentially need to isolate might be the people who shared that car and not other people in the workforce. So basically get people to stick together if they are car sharing. And then look at ventilation as well, so keeping the car well ventilated and obviously cleaning as well. We have got more guidance on our website on car sharing. For those who are not travelling too great a distance, then encouraging people to use active travel is a good approach. So bikes, or maybe even e-bikes as well, which do mean people can travel that bit further than perhaps they can on an ordinary bike. And also think about car parking. If you've got restricted car parking, can you do anything to enable people to use their own cars rather than car sharing? And finally, on the transport stuff, consider, if you can, staggering start and finish times, so you're reducing any congregation, any pinch points at the point of access, the point of egress. Again, it's just enabling people to keep that distance. Okay, so moving on. So again, really still focusing on the distancing thing. Layout of workplaces can make distancing difficult, but in general, we find that workplaces have got this really well worked out, and in terms of the actual workstations or people's desks or people's positions on lines, etc., they've really thought this through and they got this in place with things like screens. People have moved away from hot desking. People have got their own allocated spaces, etc., and lots of one-way systems. Again, lots of guidance on the national website. But what we're finding, and again, a lot of situations where we're finding this, is that while people are, if you like, on their guard when they're on their workstation in their office, when it comes to relaxing from the normal work, so if it's a lunchtime, tea break, smoking break, that's when it's breaking down, and that's where we're getting outbreaks happening. So it's really important that people can still socially distance when they're on a break. Stagger break times. You know, if there's a kitchen, tea room, can people use that at separate times, or at least making sure they're going in one at a time? Maybe can you have more than one break room? And also, again, just making sure that you've got good cleaning processes in place for those break rooms, not obviously between every individual use, but making sure they are cleaned several times a day. We've got one employer's got breakout rooms, and I jokingly said, well, if they're not careful in those breakout rooms, they become outbreak rooms. That's perhaps something worth remembering. The same applies with smoking areas. So, you know, the smoking break is often seen as a bit of a social occasion, as you'll be aware. People may be in smoking shelters, particularly as the weather gets more inclement and rain. You potentially may have numbers of people crowded into a smoking shelter, and obviously that's again breaking down the social distancing, increasing the risk of transmission. So again, it's about potentially having staggered breaks, making sure people can smoke if they're permitted to smoke on site, then smoking in potentially other areas, perhaps other than smoking shelters, because smoking shelters will increase the risk. So you may need to think about where you allow smoking on site. In terms of PPE, it's a bit of a bête noire for every public health person who watches the TV news, and literally every news bulletin sees people misusing face coverings and face masks. And we do get outbreaks as a result of this. Make sure people know how to use their masks, that they cover the mouth and the nose, that they're not touching the outside of the mask all the time and adjusting it. So it's useful to provide instructions as to what PPE is needed, when it's needed, obviously having enough stock, but really that key critical thing of making sure it's being used correctly. And there is a lot of incorrect use. Moving on to some of the broader issues. Language. We have these days many more people from communities where English isn't their first language. So it's really critical that people understand what's being expected of them in terms of their own language if they don't understand English, either in verbal or written form. Pictograms obviously work very well in that regard. People have said, well, there's difficult finding stuff in minority languages, so we have got a link there for you. Lots of really good information in lots of different languages, in text and video and audio versions that people can go and have a look at and make use of. The other thing is there are health belief barriers, a bit of a jargon term, but again, you'll be aware of various conspiracy theories. They can gain traction very easily on local Facebook groups, but in a workforce context, perhaps also think about WhatsApp groups. I know a lot of workforces or groups within workforces belong to WhatsApp. And again, we know there's a lot of conspiracy theory type views which get spread on WhatsApp groups. So be aware of that and try and address those if you become aware of them. Things like 5G allegedly causing COVID, which it doesn't. Sick pay is another big issue. If we're asking people to isolate, if people are essentially in low paid jobs, they may take a view that they're not able to afford to self-isolate. There is now a new scheme, as you'll be aware, for people who are on low pay and in receipt of certain benefits to receive a one-off payment if they're required to isolate. But it's worth thinking about, again, the business continuity aspect, that if you've got people who potentially will come to work because they have been required to self-isolate, either because they've got symptoms or because they've been contacted by Test and Trace and told to isolate. Clearly, you want your staff to disclose that to you and to isolate as appropriate. if they're under such financial pressure that's not possible, then it's worth having discussions with the workforce about how you make sure that people essentially do what they need to do. It is now, of course, as of this week, I think, a legal requirement to self-isolate if you've been told to do so by NHS Test and Trace. It's probably also worth just emphasising that bottom point, that employers mustn't require people who are required to self-isolate to go into work. Childcare can be another pressure as well. We are seeing lots of school year groups being required to isolate because of cases in individual year groups, and that has a knock-on effect for parents and childcare issues. Again, if those children then become ill, then their parents will need to isolate with them. They don't need to isolate if they're just a contact of a case in a school, unless they themselves become symptomatic. Obviously, the parents can carry on as normal, but clearly, if their own child becomes symptomatic, then the whole household has to go into isolation. In terms of workplaces, particularly industrial workplaces, they can be noisy. Obviously, if staff have to raise their voices or shout, that does increase the risk of transmission. So it's useful to think about that. Is there any steps you can take to address that in terms of noise reduction or ways around not having to shout? I'll leave that to your powers of invention to figure out how you might do that if it's at all possible. Something else we've seen is in terms of people's accommodation. So again, we see people can be living in what we call HMOs, houses in multiple occupation, more commonly known as bedsits or shared houses. And again, that can increase the number of contacts people have. If you think about this in the context of students in universities, we've seen obviously big outbreaks around the university cities in the last week or two, basically because you've had lots of people going into halls of residence or going into shared houses, and you then get spread within those households. That is also a risk for some of our employers, where people are sharing accommodation. Working from home, the guidance, as you'll all be aware, I'm sure, is that people should work from home if they can. And so if you can do your normal duties from home, again, this is essentially still achieving that social distancing. The fewer social contacts people have, the less risk they have of becoming symptomatic. But obviously, if people cannot work from home, they should still go to their normal place of work, following the COVID secure guidelines. It is important for people who are at higher risk, so people who are obese, men, older employees. You need to think particularly about any higher level of risk for those people and how their risk can be minimised as compared to healthy young people. I want to just touch on testing. So you've again probably seen on news bulletins where they have had big outbreaks in certain workplaces and on-site testing has been arranged. Don't make an assumption that's easy to sort out. Because of the levels of disease in the country at the moment, there's massive demand on the testing system. And so if you were to get an outbreak in a major employer here in Somerset, we would not necessarily be able to get a mobile testing unit in or in very quickly. We would certainly do our very best, but we can't guarantee it. And a word of warning about private testing. Just make sure you know what you're buying and why. So we have had instances of people buying in test kits, and let's just say sometimes the results are not what they appear to be. Potentially getting lots and lots of positives which are not true positives. So understand what you're buying if you're planning to buy that. Get some expert independent advice. And just finally, before we go to the Q&A, we've got the new legal requirements for self-isolation now been enforced for just over a week. So there are offences, there are fines. I won't read all that out. But there is a one-off payment of £500 through the test and trace support payment scheme if people are required to stay at home and self-isolate. It's important that workers are aware of that facility. As I touched on before, if you want to make sure that people are self-isolating, that's going to help people who are on low pay and who may be worrying about putting food on the table or paying the rent. We do know that hitherto, only about 20% of people nationally have been self-isolating when required to do so. So it's and that is a significant factor probably in driving the increases that we're seeing. So we'll move on to the questions. So I'm going to be joined now by Sarah from Sedgemoor District Council's Public Protection team. Sarah's team works a lot with helping and supporting businesses with being COVID secure. So I'm going to fire any questions of that nature across to Sarah. We'll move on now to any questions. Okay, do we have any questions?
No questions, Stuart.
Okay. Okay, let me ask Sarah. Sarah, is anything that I've not covered in the presentation that you think may be useful to people listening?
Well, I think you've covered everything off in the presentation, but my only comment would be is that if you had any concerns that you have a case and you know a member of your staff is unwell with COVID, obviously follow the advice Stewart has given, but also don't be afraid to either contact Public Health England or also contact the local authority in which you're based, because actually the environmental health teams in your local authority can give you some advice straight away. No one's going to come and suddenly close down your business, so don't panic about that. It's much better that we have a nice sensible conversation maybe before we're in an incident situation. In the same breath, if you have a positive case, or a member of the public contacts you and said, I came to your restaurant and now I've tested positive for COVID, then also don't panic. Speak to Public Health England, speak to your local environmental health teams, and we can absolutely give you the support you need to get it right and move on from it, really. If you're sitting there in your business at the moment and you're thinking to yourself, oh, I'm not sure if I've got this quite right, then also contact Environmental Health, contact Public Health England, look on the .gov website, and we can definitely give you the some advice relevant for your business, really. So don't sit there and think, I'm not sure. Just pick the phone up and ask the question. We've had lots and lots of businesses contacting us, asking us, is this right? Is that right? Am I able to do this? Am I not able to do that? So that's quite important. I think the first slide, when Stewart touched on earlier about, if you are classed as a close contact, then you are, by that nature, you need to isolate. You need to self-isolate for 14 days. We've had earlier on a lot of businesses who may have had members of staff classed as close contacts that kind of got them all tested quickly. And there's that assumption then that if you have a negative test result, you can return to work, which is incorrect. And Stewart picked up on that early on. So it's really important to remember that if you are supposed to be self-isolating, you can have as many negative tests as you like, but you need to continue to self-isolate. That's probably what I would add, Stuart, if that's okay. Yeah,
that's great. Thank you, Sarah. I'll just come back on something you said there as well, and just add to it that we have had quite a number of business premises, particularly in the hospitality sector, who have closed in response to being told by a customer or a member of staff that they've tested positive for COVID. And actually, it's very rarely necessary to close, other than perhaps just briefly for apologies, that's my phone going. I thought I'd turn that off. Yeah, so yeah, it's rarely necessary for a business to close, other than perhaps briefly just to do some additional cleaning. So if you were a pub or a restaurant, very likely you would close just briefly, and then there's no reason why you wouldn't probably be trading the next day, unless you've got lots of your staff who are close contacts, and therefore you're not able to operate because you've ended up as close contacts within the business, and therefore are all having to be isolating as close contacts of the case. And that comes back to the point about avoiding being a close contact. So I'll give you another specific example. I was dealing with a case yesterday who would have a close contact because she would normally be working in a room where that's not avoidable in the work she was doing. But in general, they're social distancing. They're keeping their distance within that workplace with the other people in the workplace, except when they go for lunch. When they go for lunch, they relax. They're all in a small room and they're not socially distancing. And I expect that business will probably have to close because they're not going to be able to carry on because pretty much all the staff are going to be classed as close contacts and have to close down for 14 days. And clearly nobody wants that situation. It is avoidable and it's really key. And just to emphasize the points on the slides, a lot of these situations arise because people are in a more relaxed setting than where they're actually working. Another example is we had what looked like a workplace outbreak. It wasn't. It was a leaving do outbreak. A colleague was leaving the employer. They went to the pub, and there was lots of hugs and etc. going on because the person was leaving, and consequently they ended up with an outbreak. So that's another couple of examples just to illustrate that to you. Okay. Do we have any questions coming in?
Yes, Stuart, we've had one about face coverings and visors when social distancing is a problem.
Yes, when it states face covering as a visor considers as one when social distancing is a problem. No, is the short answer. There is an issue with visors that are used without a face covering or a face mask because they tend to act as a bit of a downward funnel. If you think about if you're breathing out and you're potentially breathing out virus particles, that visor, if you're not wearing a face mask as well, will tend to just funnel the breath downwards. So, for example, if you're in a restaurant situation and the waiter is using that to serve food and they're potentially breathing particles actually down towards the table and the diners. So it's really better to be wearing a face covering or a face mask. Now, obviously, not everybody is able to wear a face mask, and if they're not able to do that or a face covering for medical reasons, they are exempt from that. In that situation, a visor will be better than nothing, and a visor in addition to a face covering will be better than just a face covering, which is why, for example, in personal services, there's a requirement to wear both the visor and the face mask. The visor protects the eyes, of course, as well as the nose and mouth. So in general, I would advise that the face covering the mouth and nose is the most important thing. The visor is an extra additional measure, but it shouldn't normally be instead of a face mask or face covering. Okay, I hope that answers that question. Sarah, anything to add on that one?
No, I don't think so, thank you.
Okay. All right. Okay, I don't think we have any more questions coming in. So I'll give one last shout out. If you have any questions, this is your last opportunity on the call. As Sarah said, you can contact your environmental health department at any of the district councils in Somerset. That's Mendip District Council, South Somerset, Sedgemoor, or Somerset West and Taunton. If you do get any cases reported to you, ask for help from those departments. Or if you're notifying cases, particularly if you have more than one case, you should notify the Public Health England Health Protection Team. And we have information on our website, the coronavirus website, which is in the Q&A for you to see. We have information on there for businesses, including posters that you can use in your workplace about what to do if you get a case. Don't panic, as Sarah said. There's lots of support available to you. We're in public health are working 7 days a week, providing support to businesses and many others in their response to COVID. including schools and the NHS as well, of course. So don't ever feel you're on your own. We're here to help and support you if needed. Okay, we will be putting a recording of this on the website as well, so any businesses that haven't been able to join us today, or if you want to look back, you'll be able to do so, and the slides will be available as well if you want to use those slides within your own settings too. Okay, well, thank you all for joining this webinar today. I hope you found it useful. I hope you've learned something that you can take away and improve your response to COVID, and I'll wish you all a COVID-free autumn and winter. Thank you very much.